Hello, and welcome to our listeners around the world. You're listening to JAMA Clinical Reviews. Thanks for joining us. I'm Anne Cappola, Senior Editor at JAMA, Professor of Medicine at the Perelman School of Medicine at the University of Pennsylvania, and Director of the Penn Medical Communication Research Institute. Joining me today is Dr. Alessio Bricca, who is at the Center for Muscle and Joint Health in the Department of Sports Science and Clinical Biomechanics at the University of Southern Denmark. We will be discussing his piece from JAMA's Communicating Medicine series titled Communicating with Patients About Physical Activity. Welcome, Alessio.
Very happy to be here. Thanks for having me.
Let's start with the underlying premise of the article. Why did you choose to focus on physical activity for individuals with chronic conditions?
Well, physical activity is a very good investment for people with one or more chronic conditions. Several systematic reviews have shown consistently that it improves health without increasing the risks of serious adverse events. But despite this common knowledge and widespread knowledge, the vast majority of patients with chronic conditions have very low levels of physical activity. And what we argue is that an overlooked aspect on the complexity of physical activity is how clinicians talk and communicate about physical activity with patients.
Now, physical activity can be a touchy subject. What is the best way to initiate a conversation about physical activity with an individual with chronic conditions?
A quick and simple way to do that can include questions like, is it okay if we talk about physical activity, or has a healthcare professional talk with you about physical activity? And what I want to stress is that this is a very delicate phase in the conversation because these patients have heard many times that they should be more physically active, but still they have not managed to do so. So the entry question is particularly important to set up the scene for a nice conversation.
What do you say to the patient who responds negatively at the suggestion of increasing physical activity?
On one hand, I think we somewhat need to accept that not all patients will improve their physical activity, regardless of what we do. But one question I would ask is, the patient to elaborate on the reasons why he or she does not want to talk about physical activity. So something like, may you elaborate on why you don't want to talk about physical activity?
Now, assuming that someone does want to talk about physical activity, or maybe if they don't, you make a really great point in the article that I liked about the difference between physical activity and exercise, or specifically structured exercise. Can you elaborate on that and how you would explain that to a patient?
So there is a lot of misconception about what is what in terms of physical activity and exercise. I think the most responsible is us researchers that have used these terms interchangeably in the literature. But in the clinic, in a very pragmatic way, what I would tell patients is that physical activity is basically any movements that is done during the day, including activities like gardening, walking or cycling to work, going on foot to the supermarket, or climbing stairs. Instead, exercise is something much more specific. It falls within the umbrella of a physical activity, but it's a structured plan of physical activities. And in people with chronic conditions, the ultimate goal is usually to reduce the symptoms and reduce disability. And that's why we often call it exercise therapy.
And do you feel that when talking to a patient, they may feel more receptive to the idea of start with increasing your physical activity rather than having to think of a structured program and the exertion that goes with that?
That's a good question. Well, I think that it depends on the patient characteristics, needs, and preferences. For some, it might be more appropriate or convenient to be, for example, referred to places where there are structured programs that can help increase physical activities, whereas others can do it without joining a specific class.
Now, there's some parallels in the stigma and blame that can arise in the discussion of physical activity and also of weight loss. How do you address the stigma and the negative feelings that patients may associate with increasing physical activity or exercise?
What we argue is that it's about shifting the conversation from being judgmental to presenting physical activity as an opportunity. And therefore, it is important to acknowledge that physical activity is a complex behavior and it's not so straightforward to increase it. There are many challenges in life that could go in the way or in the journey towards becoming more physically active. And making the patients aware that this is common can reassure them and make them feel more psychologically safe also to talk about physical activity.
Can you give an example of what you would say to a patient?
Yes, I would tell a patient, well, I know that physical activity is hard. There are many challenges and barriers towards physical activity, but I'm here to try to find opportunities where you could become more physically active.
What about discussing physical activity and weight loss in the same visit? I'm sure there's not a literature around this, but what would you advise based on your knowledge about physical activity and probably having looked at some of the weight loss literature as well?
Overall, I think that ideally, all key health-related behavior should be considered in the consultation, which include weight loss if necessary, smoking cessation, alcohol consumption, sleep, and physical activity. So ideally, all these health-related behaviors should be at least considered. But of course, it always depends on the individual patient characteristics, their needs, their preferences, as well as the capability of the clinician to talk about these health behaviors. So overall, I think that it should be at least considered.
What kind of advice do you give about the dose and intensity of exercise when you recommend that? And how is that something that we can incorporate into our practice?
In practice, very pragmatically, I think that the optimal dose and intensity is the one that the patient wants to do and can do now and over time. And this is very much in line with the latest message from the WHO guidelines on physical activity and sedentary behavior, where it's clear that they do recommend that every move counts. However, the WHO guidelines on physical activity also highlights that adults should at least perform 150 minutes per week of aerobic, moderate intensity physical activity. And this could be the goal, maybe long-term, from most patients, and not the starting point.
And so what would you say to a patient when trying to counsel them on getting started and getting that movement going and dose and intensity?
I would, on average, recommend starting for the least active with very small bouts of physical activity, which could be up to 10 minutes, and recommend them that when being active, aim to breathe faster while still being able to talk, which is a pragmatic way of telling them, be physically active at a moderate intensity.
Okay, so my patient increases their physical activity. How can I help them continue to do so?
That's a very good question. And this is the second biggest challenge, I think, that there is in terms of physical activity. So first, I would tell the patient and the clinician, well done. That's not so common. But second, I would recommend using behavior change strategies to help the patient maintain physical activity. And these strategies include pairing up with a buddy or a friend, or overall getting some sort of social support to maintain the physical activity. Additionally, other strategies such as self-monitoring of the behavior via a wearable, for example, a digital tool, or an activity log has been shown consistently to promote maintenance of physical activity, as well as setting a goal. And in this case, what I would focus, it's not the outcome itself, which could be, for example, fitness, but the actual activity. So, for example, walking 10 minutes Monday, Wednesday, and Friday at moderate intensity before dinner.
All right, that was incredibly helpful. Do you have any final thoughts?
As we tell patients that every move counts, I would tell clinicians that every word counts when communicating about physical activity. And finally, I would really like to thank the co-authors of the paper, Professor Julie Midtgaard and Professor Sorensko, which really helped to make this possible.
Thanks so much. It sounds like there are opportunities while wearing your wearables and listening to things to listen to podcasts. So let's encourage people to do that and do whatever it takes to keep moving. I am Dr. Anne Cappola, and I have been speaking with Dr. Alessio Bricca about communicating with patients about physical activity. You can find a link to the article in this episode's description. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.